I'm John Soka. Our state government is broken, and if not fixed, North Carolina is heading for much tougher times, higher taxes, and possibly bankruptcy. So how do we fix it? First, we have to stop spending on projects we don't need and can't afford, like extravagant fishing piers and teapot museums. Secondly, we need to stop overregulating our businesses. We need to use taxes for their intended purpose. In the last 3 years, the legislature siphoned off over $256 million from the Highway Trust Fund to pay for some of those projects we don't need and can't afford. Is it any wonder we have the highest gas tax in the Southeast? And finally, we need to cut taxes for businesses and individuals. Our tax rates are among the highest in the Southeast, and that penalizes all of us and makes us uncompetitive in attracting new businesses. This year, you have a choice to make. You can vote for my opponent for business as usual, or you can vote to reform state government and get things right. I'm John Soka, and I'm asking for your vote to represent you in Raleigh as your next state representative.
Welcome to the Saturday Show. I'm Kurt Vincent, General Manager and Editor of the Bladen Journal. This week, our guest is Deborah Brisson. She is the Director of Nursing for the Bladen County Health Department. Welcome, Deborah. Thank you.
Thank you.
This week, we want to talk about flu season. Obviously, the seasons have just changed, and we're in fall, but we're also in that flu season. Tell me who's most vulnerable for flu?
Well, anybody 6 months of age and up, and also individuals 65 years of age and older are more susceptible for flu. The CDC is recommending that everybody 6 months of age and older receives a flu vaccine.
Okay. Now, there are a number of types of vaccines. Can you explain those different types?
Okay. We have a new vaccine this year called Fluzone HD. It is formulated for individuals who are 65 years of age and up. It has 4 times the antigen that the regular seasonal flu vaccine has, so therefore it will give them more protection. Their immune system, just like the infant's immune system, is in a weakened state, so they don't get the immunological response from the seasonal flu that, say, someone less than 65 would. So that Fluzone HD with 4 times the antigen is formulated for them so that they are protected more against the flu virus.
Now, something that I've heard over the years is that when somebody gets a flu shot, specifically the first time, that the shot actually gives them the flu. Is that correct?
No, that is not correct. Years ago, when the swine flu vaccine first came out, we had a lot of individuals who were getting sick. However, that was a formulation of the vaccine. The vaccine that we have this day and time is in a weakened state, and it will not give you the flu. However, it takes 2 weeks for that vaccine to generate an immunological response in your body so that you will have protection against it. So if at some point in time, from the time of vaccination until that 2-week period is up, if you become exposed to the virus, then you have the potential to develop the flu.
Okay. Now, we were talking earlier about another type of vaccination, DTaP.
Yes.
Could you explain what that is?
Okay, DTaP is the adult tetanus with acellular pertussis in it. We started administering that to students in the 6th grade probably about 3 years ago. The North Carolina immunization law was changed to make that a requirement for students entering the 6th grade because studies have indicated that as we get older, our protection against pertussis that we received as a child going into kindergarten is getting less and less. So we need that booster so that we're not carrying that bug in our body and having the possibility of spreading it to the infants who have not had the chance to get their vaccinations. So what we're doing, we are having a campaign to get everybody in that age group from 10 through 18 to get a Tdap so that, number one, they'll meet the school requirement for staying in school, and then number 2, we will be able to ensure that the pertussis is cut down and that we're not out there having to do a lot of case studies for pertussis cases.
Now, talking about pertussis, the average person probably knows that as whooping cough?
Whooping cough, that's correct.
Okay.
That's correct.
Now, there's also another vaccination that we discussed a little earlier, Menatra?
Menatra, that's correct. That is to help prevent meningitis. and it is recommended for individuals 11 through 18 years of age, and individuals who are going off to college, who are going to be living in a dormitory setting, they're encouraged to get it because they find that when students congregate and live together, things are spread faster.
Right.
So,
Now, for folks who are interested or need to get their flu shot or these other vaccinations, how can they go about doing that in Bladen County?
they could just come here to the health department from 8:30 till 11 and 1 to 4, Monday through Friday. Just walk in, tell the front staff that they want to receive a flu shot, and we'll take it from there.
Is there a charge?
There is a charge. The regular seasonal vaccine is $35. The Fluzone HD is $55. However, it is covered by insurance, and we do file insurance, both Medicare, Blue Cross, MedCost, and United.
Now, for somebody who might have some questions before they want to come over, what's the phone number they can call?
The number here at the health department is 910-862-6900.
Now, I understand you've agreed to go ahead and have your flu
I
shot
am.
today.
I have not had mine yet, and it is time.
Okay, well,
So, and Ashley is
let's do
going
that then.
to give me my vaccine.
Okay. And these only take a few minutes and
Not even that long.
painless, right?
Yes.
Okay.
That's it. Didn't feel a thing.
And you smiled all the way through.
Uh-huh. And one thing too, people can just walk in for a flu shot. They don't have to have an appointment. And if we have staff that is available to help so that they can expedite their visit here so that they don't have a long wait.
Great. Well, Deborah, thank you very much for joining us.
Thank
I
you.
appreciate it. And thank you for joining us on the Saturday show. You all have a good week.